The nation's largest school district, New York City, is delaying the opening of public schools until September 21st. Mayor Bill de Blasio announced today a deal has been reached with the teachers union. City schools were originally set to reopen September 10th, but teachers had threatened to strike over safety concerns. The delay is intended to give them more time to prepare. Meanwhile, schools are slowly reopening across the country as the nation eclipses the 6 million mark in the number of COVID-19 cases. The death toll stands at nearly 184,000. For more on this, I want to bring in Dr. Eric Cioe-Peña. He is the Director of Global Health and an emergency room physician for Northwell Health. Dr. Cioe-Peña, thank you so much for joining us. So students around the country from kindergarten to colleges and universities have begun going back to school. The major concern for parents, however, is it safe? We keep hearing stories of spikes here, spikes there. What do you tell parents?
So thank you for having me. And it's a very complicated math, right? And, there's certainly lots of benefits to children who are at the lowest risk of COVID-19 to going back to school. It can be done safely. We need to think about this in a way that's very responsive to the local community prevalence of the disease. So obviously, if you're in a community where the prevalence is just skyrocketing, in-person schooling is a very high-risk activity. In places like New York and New Jersey, where the prevalence is at all-time lows, the risk is less. It still needs to be done smartly and with good data to prevent infections from spreading throughout schools. But I do think there's a benefit to children going back to in-person schooling, and that should be weighed in the math when we're making these decisions.
Yes, I am so thankful that my kids are going back to school in a few weeks in person for now. But doctor, today is September 1st and summer is wrapping up. Are there concerns about another coronavirus spike this winter, especially when you combine it with the potential for flu season?
So I think that's a really good point. And, we are looking at flu. If the northern hemisphere behaves like the southern hemisphere, hopefully flu numbers will be very, very decreased this year as well because of social distancing and mask wearing. In Australia, flu is down 99%. So that's a good sign. I think we should take advantage of the fact that as we are in the fall months, getting into outdoor schools and schooling in open air environments for as much as possible, which we know is the lowest risk way for people to gather, we should be using the environment and using the mild weather to our advantage and trying to do that as much as possible. I do think we're going to have a challenge as we get into the winter months of how to do that as we need to naturally move indoors more and more.
Yes. Yes, I was sort of hoping that schools would move up the start date rather than push it back, which is what a lot of schools seem to be doing because of exactly what you mentioned, the fact that we have relatively low rates in some parts of the country right now, and it's the warmer weather. But again, there's a lot to do to prepare, so I understand why teachers say they need more time. I want to ask you about pharmaceutical company AstraZeneca. It says it has begun a final round of testing in the U.S. on its coronavirus vaccine. Do you believe this is promising? And what's the latest on when we could expect to see a vaccine?
Well, I think it's promising that they're moving to the final stages. I'm not privy to any of their data, so I don't know what their data looks like and how it's going. There's been a lot of questions about the ability of a vaccine to generate sufficient immunity that it will last for long enough to have an influence and effect on this pandemic. So we're all eagerly awaiting the data. I do think that we are moving swiftly, and I want to make sure that we're doing this based on good science and that we are producing a vaccine that's going to be useful, that's going to generate enough immunity for long enough to kind of break the cycle of transmission and allow us to recover from this. And I very much hope to see pharmaceutical companies putting out data to that effect.
And so, finally, there is some talk that some Trump administration advisors are pushing for herd immunity. What can you tell us about that? And why are so many health officials saying they don't believe that's a good option?
Yeah, I mean, it's not a good option because it means that hundreds of thousands, if not millions more Americans would likely die from coronavirus. But in addition to that, we're not sure that the natural infection will generate immunity for sufficient time to prevent reinfection. I mean, what if we generate herd immunity and it all lasts 4 to 6 months? That's one of the concerns with this kind of herd immunity principle. Is it's not great based on good public health and good epidemiological data, and I think it's risky, and it certainly is going to put many, many more lives at risk than the 184,000 that have already died from this.
Right. Right, because doctor, correct me if I'm wrong, but isn't the understanding right now, with the medical research showing that right now you can't really prove that even if you've had the coronavirus, you don't have more than 4 to 6 months of immunity protection from it?
Correct. I mean, the longest data we have on this is only about 9 or 10 months old. Remember, this virus didn't exist before, at least in our surveillance, before November, December of last year. So we have a very limited data set. And so we really don't know what the immune system's reaction is going to be to this and how long that immunity is going to last. There are some studies that show that the immunity wanes after 2 or 3 months. And we don't know what that means. I mean, certainly decreases in circulating antibodies is one thing. There's other parts of the immune system that we can't directly measure, but we really don't know what the long-lasting effect of a kind of natural infection with coronavirus is going to do. So we aren't confident that this herd immunity principle is sound science.
All right, so many questions still surrounding the coronavirus. Dr. Eric Cioe-Peña, thank you so much for joining us.
Thank you for having me.